Today marks 3 weeks now from the first TMS mapping and treatment. I'd say things are trending upward still. Really no big difference from yesterday, but also, so I wanted to just kind of take the extra time to talk about what might sound like a controversial topic. There's a quote from, I can't remember who, that basically says Prozac is the most overprescribed and underprescribed medication in the United States. I don't necessarily agree with that, but it's a provocative statement. Kind of the thing I wanted to talk about it is that we as a society are driven for like a quick fix, temporary fix, especially when it comes to medication. I see it all the time in the field I work in, physical therapy, where people would rather just take a pain pill or take ibuprofen for the rest of their life than potentially address an issue that is affecting their daily life, because it takes work, and therapy is work. So let's transition to the mental health world. In our super fast rat race society, work, grind it out, keep up with the Joneses, have your status symbols. People are burned out. And I think a lot of people end up taking medication for something that's not pathology at all, but is just an insane amount of stress that your body and mind was never meant to handle. And then on the contrast, you have on the other side, you have tons and tons of people out there who have serious mental health issues, pathology, anxiety that isn't based on lifestyle or anything like that, that aren't getting help at all. It's this weird statistic that there's a super high percentage of people with depression that never seek out treatment at all. So if you find yourself stressed and depressed and anxious, and you've never talked to anyone about it, or never thought about counseling, I really, really, really recommend it. Even if you end up needing medication to help, which there's no shame in that at all, therapy is a very crucial part of the process. I've described it once before with talking to someone. I remember seeing a tree in our backyard that from a distance looks fantastic and lush and green, and as you get close to it, you see that there's very few leaves. It's actually covered mostly in vines. And sometimes depression can look like that from a distance, like somebody's doing okay, but when you get up close and you get in there, you see that depression has really taken root and choked out a lot of life. Medication may be comparable to cutting the vines, killing the vines, and therapy would be taking the time to untangle those vines from off of that tree so it can grow again. There are parts to both. Unfortunately, there's this stigma with therapy that people say, no, I don't need it, I can figure it out myself, when it's obviously affecting their life and their relationships and their work. Please go out, find a good therapist. We've got a video on the Mental Health Matters account here that John Thompson did on things you can do to find a good therapist, and also when you should seek out a good therapist, some criteria to look for. So check that video out as well. And that's my main takeaway for today. There's no shame in getting help, and I'd really encourage you to reach out. find a therapist, talk with the doctor, make an appointment with a psychiatrist, and do the hard work that is actually most beneficial in the long run. Have a good day.